Okay, so now we're going to go on to our agree, disagree activity. If you have not completed the activity on Google Classroom, I invite you to please pause the video and complete the activity. If you've not completed the activity, here are some directions. The activity is almost all opinion-based, with a couple true fact ones in there. And I want you to just go through and put what you agree, disagree, or unsure about. And then after you've done that, then we're going to go over the activity together with some common responses I typically get and just have a little bit of discussion on them. Okay, so pause the video now if you have not done it. All right, so if you're listening at this point, then you've completed the activity on Google Classroom. So now we're going to go through them, and remember that almost all of these do not have a right or wrong answer. We're just going to go through what are the most common responses. So the first one is, you can tell by looking that a person is healthy and not infected with HIV. So for this one, actually one of the few true-false ones. So this one is false. You cannot tell that a person has or has not HIV. Especially with new medicines out now, you can live a totally normal and healthy life with HIV, so you could definitely not know that you have it or your partner, which is important, why it's important to get tested and to talk with your partner. Next, it is very difficult to tell a partner that you want to be abstinent. For this one, we usually have more people that agree than disagree. Talking to your partner about being abstinent can be a really touchy topic. Many people want to try to impress their partner and seem more mature, so they have sex even if they don't want to. So first of all, you should never ever let someone pressure you into having sex. And if that does happen to you, realize there are adults and resources you can reach out to, because you should never have that happen to you. Now, so talking with your partner, there's a lot of ways that you can talk and discuss what you're most comfortable with and what your partner's most comfortable with. So if you continue with their modules, in Module 6, we'll actually touch on how to have those discussions. So we hope you stick around and you can learn how to deal with that. Next, it is very difficult to ask a sexual partner to use a condom. Most people agree with this one, but there are people who disagree. This can usually be really scary, just like the last one. You want to impress your partner, and a lot of people are afraid that if you ask them to use a partner, it's insinuating that you or your partner have a disease or something. But in reality, using a condom with your partner is the responsible and safe thing to do. And we will touch on later how to have that conversation with your partner as well. So next is, people don't like to use condoms. Unfortunately, a lot of people agree with this, and a lot of people feel this way. The common responses are they don't feel good, it doesn't feel as natural, it's not fun. And we're not going to lie, all those things can be true. However, it can also be true that condoms can be really fun. They can introduce new sensations into the bedroom, new colors, new tastes, new experiences, and condoms can actually even spice up the bedroom. And if you stick around for Module 5, we can go into all the different ways to actually make condoms really fun. So next is, people do not need to worry about getting HIV when they know their sexual partner very well. So for this one, we have people usually split down the middle for agree and disagree. A lot of people agree on this one because if you and your partner are loyal to each other, then you should not get HIV for them, and they shouldn't get it from you. And in a perfect world, I would say that is true. If the two of you stick together, yes, you shouldn't get it from each other. However, that is unfortunately not how the real world works. There are a lot of ways that you could get HIV from your partner that you believe is loyal to you. The first way is very, very rare and unlikely, but it's possible that your partner was born with HIV and doesn't know it. Another one is your partner could have used a shared needle. This could have been on purpose by using drugs or other things, or it could have been accidentally, such as going to a tattoo parlor that they assumed was a reputable place, but didn't use a sterile needle. And then lastly, while we never hope or expect our partner to cheat on us, it unfortunately does happen in the real world. So in all those instances, your partner could get HIV and then give it to you. which is why it's important to protect yourself whenever possible. So our next one is people don't use condoms because they don't know how. This is a common excuse that we hear. So a lot of people do disagree and agree with this one. There are a lot of people in this world that don't know how to use condoms. And there's actually a lot more steps than most people know. It's very common that even if it's not your reason, it does lead you to not using them correctly. So in Module 5, we're going to go over step-by-step how to use condoms, and then you and your partner will be prepared when the time comes. So next is people who want to avoid HIV should abstain from having sex. So for this one, we usually get a 50-50 split. And I think that when it comes to this one, it's pretty good to have a 50-50 split. And that's because in certain times of your life, this one will be completely true. I have to worry about unplanned pregnancy, HIV, STDs, and all the consequences and risks that come with sex. So you just decide it's just best for you to not have sex at all at the moment. And hopefully all of you as teenagers feel that way, but in the reality, that's not always necessarily true. Most people at some point in their life have sex, and at some point you are going to accept that there are risks and do it anyways. And that is fine as long as you take the proper precautions and safety measures to make sure that you can focus on the pleasure and not have to worry about the risks, which includes using protection, using birth control, and all those things, so your partner can really enjoy the moment and not have to worry about anything else. So our next one is people who decide to be sexually active can protect themselves by practicing safer sex. Hopefully you all agree with this one. If you are safe about how you have sex, you're less likely to get any type of STD or HIV or unplanned pregnancy. And we will go over all the ways you can have safe sex. Our next one is most people are afraid to talk to their partners about HIV. And unfortunately, this one is pretty true. It can be really scary to have to talk about any type of STD, especially HIV, since there's such a huge stigma around it. And it can be really embarrassing to even talk about. A lot of people are fearful, oh, if you're talking about this, that means you have it, or you think that I have it. And it's important to have that conversation with your partner to be like, no, it's not that I think you have it or that I have it, but it's just I want to protect me and I want to protect you. So I think it's important for us to discuss this, the risk factors, so we're safe going forward. Now, if your partner really cannot handle this conversation, there are two things that you should keep in mind. First, they do not care about your health or their health as much as they care about having sex with you. And your health and safety should always come before the pleasure of sex. And then secondly, if they're not mature enough to handle this difficult conversation and this more harder part about sex, then they definitely aren't ready to handle the pleasurable and enjoyable parts of sex as well. So keep that in mind. And now we finished Module 1. So awesome, great job. Before you move on to Module 2, please make sure you complete the HIV Myth and Facts worksheet on Google Classroom and watch the 2 videos before watching the Module 2 video. Thank you.